Unfortunately, a lot of us walk around with anxiety and depression without even realizing it. The constant mood swings and feelings of melancholy aren't normal. Trust me, I know, because I have been in and out of a constant state of anxiety and borderline depression for many years. It's debilitating and emotionally and physically draining. It sucks the life out of you in a way that is difficult to articulate and describe. When you do express it, not everyone, even yourself, believes it. So you continue in this spiral of confusion, which is why this topic is particularly important and very welcome. Because my hope is that like me, a lot of us find practical steps to help us out of the darkness and back into the light. My guest, Chris Abojie, I hope I pronounced his surname correctly, is the founder of PsycAid EAP and has many years of experience in mental health treatment, research, advisory, and training. He is a licensed clinical psychologist, certified employee assistance professional, and a wellness trainer. Welcome, Chris. It's really good to have you here with us today.
It's a pleasure to be here. It's a pleasure.
Awesome. Awesome. So let's delve right in. What is anxiety and what is depression?
Okay, thank you. So anxiety and depression are considered as mood conditions. That means that they affect the way you feel. While depression is a mental illness, anxiety, on the other hand, can actually be an expression of feelings and also can be a classification for a mental illness or a category of mental illnesses.
Chris, can I ask you to please, sorry, Chris, can I ask you to please speak up because we can't really hear you properly?
Can you hear me now?
Yes, it's a bit better.
Oh, okay. I'm actually speaking almost
the joys of Zoom.
So I don't.
Yes, so can you just repeat your answer again, please?
So yes, I was saying that anxiety and depression are both mood conditions. They affect the way we feel. I think that's a simple way of looking at it. They affect the way we feel. Depression, on the other hand, has to do with experiencing extremely low moods. Sometimes it could be a feeling of emptiness. And this goes on for a period of time alongside other symptoms, which hopefully we'll talk about as we go on. But anxiety, on the other hand, could be used as an expression of a normal expression of worry. So we always say that a bit of anxiety is normal. However, it could also be used to describe a category of illnesses or disorders called the anxiety disorders. But I think the major characteristics that you need to look out for is that there's an excessive worry. It could be a worry about almost everything, which is in the case of what we call generalized anxiety disorder. In some other cases, it could be a worry or a fear about a specific thing, which is in the case of phobias. But there are different types of anxiety, just also as there are different types of depression. But one thing you need to really understand is that both of them affect the way you feel or the way we feel as individuals and can affect our functioning over time.
Thanks for that, Chris. You said both of them affect how we feel and our behavior. Can you tell me what the worst case scenarios could be in both instances?
Well, worst case scenario, we then look at severe depression and then, of course, severe anxiety disorders. So, take for example, in the case of severe depression, or what we might call major depressive disorder, that might come with suicidal thoughts, thoughts to hurt yourself or end your life, or generally. And so you would see that these individuals would have symptoms of low mood, loss of interest in things they used to love doing before, feeling hopeless, helpless, worthless in some cases. It could also affect appetite and mood in different ways. So such that some people find themselves doing more, that means eating more, sleeping more, and in some other cases, eating less and sleepiness. But most importantly, it affects the way they function, the things they used to do before. They lose interest in doing those things. They're not able to function at work, at school, or other areas of their lives. But the most important thing with major depression is the suicidal thoughts and, of course, the self harm that could be associated with it. Uh,
Okay, so you said the okay. So I did say worst case scenario, but can people, Chris, are you with us? Because we're losing you. Maybe we should go on a quick commercial break. We'll be back in a few seconds. All right, thank you so much for staying with us, and sorry for that interruption. Sometimes Zoom messes us up. But yeah, so I was asking Chris about the worst case scenario, which he had explained, but I also wanted to know, can you be functional and still be depressed? Because I worry about the fact that a lot of us, because we're able to function, we don't actually realize that there's a real problem. So, Chris, can you please explain that?
Oh, yes, it's possible to be functional and to be depressed and functional. In fact, that's something we call, for the listeners, I would just call it chronic depression, right? So, also known as dysthymia. It's more like it takes about 2 years to diagnose, but what that simply means is that this individual is experiencing mild to moderate levels or symptoms of depression, so they are still able to go about their daily activities, but they just understand that there is that feeling of that low mood and those subtle symptoms that are just hovering around somewhere. On some days, they wake up not feeling really good, feeling sad, or in some cases, losing energy and interest in doing things. But they just find a way to keep on, going about life. So yes, there are cases of dysthymia, which we can also call chronic depression. And in cases like that, people could be functional in quotes, but still fit the criteria for depression.
So let me take us a few steps back. What are some of the symptoms or signs that somebody is going through, whether it's anxiety or depression? How do we then begin to identify what we're going through?
Okay, so for both of them, like I mentioned earlier, that is a thin line between anxiety and depression, and that's because they can coexist. However, I think that the core difference is that for anxiety, you're likely going to see this, persistent worry, persistent worry that is accompanied by unpleasant feelings. For example, the individual, struggles with sleeping, so they could sleep much or they could sleep less. They experience this nervousness, uneasiness that can come with that. For anxiety, you could also experience increased heart palpitations, so the heart is beating faster. Sometimes they find themselves sweating, and in some cases, in case of panic, they could even lose consciousness. But in the case of depression, you'll probably be seeing things like feeling of worthlessness, feeling of hopelessness, extreme low mood, of course, increased sleep or decreased sleep, increased appetite, decreased appetite. But most importantly, there is that feeling of inadequacy that is associated with depression. And in the case of of major depression, it could also include things like suicidal thoughts, thoughts of ending their life, or even self-injury. So some people begin to cut themselves, and as a way of trying to mask the emotional pain that they are experiencing. So these are some of the symptoms that you could look out for to identify whether a person is experiencing anxiety or depression. But in some cases, like I mentioned, you can see both of them coexist. In fact, there's a condition called mixed anxiety and depressive disorder. So you have the symptoms of anxiety and depression within the same diagnosis.
Is it easy to fix? What's the way forward?
So in mental health, we don't talk about fixing disorders, right? And I think this is not just about mental health. It applies to every chronic illness. So when we say that mental illnesses are chronic,
that means that you have to manage them for a long time. Now, of course, when we say you have to manage them, it comes down to lifestyle modification. So we would not talk about fixing it, we would not talk about curing it, right? But we will talk about treating it and managing it. So anxiety disorders as well as depressive disorders can be effectively treated and effectively managed. Now they can be managed by the use of medications, or in some cases psychotherapy, and even the combination of both of them. But yes, they can be effectively treated and effectively managed.
Be effectively treated and effectively managed. This sounds very clinical. So, are you saying that if somebody suffers from anxiety or depression, that is their life forever? Could it not be a temporary thing that once you get to the root cause of it, you can begin to treat it?
Well, so I like that you ended with the word treat it, and the answer is yes, it can be treated, right? The reason why we don't talk about cure is that many times when people think about cure, they're thinking about, oh, you know what, there's one thing I can do, and forever in my life, I will never experience this thing again. Now, that is not what we talk about. And the reason why we don't talk about that is that mental illnesses or mental health concerns, especially the neurotic ones like depression and anxiety, have a lot to do with your lifestyle, right? They have a lot to do with your lifestyle. They have to do a lot to do with your previous experiences and how your previous experiences could have shaped your thoughts, shaped your pattern of thinking, and shaped your behavioral responses. Now, what that simply means is that if you want to manage, if you want to treat anxiety or depression, you need to start first from dealing with the, resolving some of the past experiences or past trauma that you might have had, right? And then you need to also develop healthy coping mechanisms. How do I manage situations like this? Let me give a very practical example. A person might be experiencing depression right now, or maybe let's even take anxiety, because while growing up, they were emotionally abused, or physically abused, or even sexually abused. And so they have learned to see the world in such a way that the world is seen as threats, as risk. So everything they go through, they are perceiving something bad will happen, something bad might happen. And that leads to an anxiety disorder for this particular person. Now, you can give them medication so they feel better, right? But until you go back to help them resolve those cognitive distortions or those hot leads, you have not dealt with that problem. So you're only putting bandage to make them feel better. And so for you to effectively treat it, you need to deal with those past experiences and then teach them ways to cope with future and present experiences. So that's why we say that we don't talk about cure. Why? Because it's a lot about lifestyle. You don't stop the lifestyle because you feel better. So the fact that I'm now assertive, for example, doesn't mean that the moment I stop feeling anxiety or I stop feeling anxious or depressed, I should stop being assertive. No, I have to keep on being assertive if I want to maintain that mental state for a long time. And that's why we talk about treatment and management so that people have that mindset that it's something they need to keep on doing to sustain that level of treatment. I don't know if this, I hope this explains this to you.
It does, but here's the thing. The example, the practical example you use, a lot of listeners would say were extreme examples: physical abuse, sexual abuse, emotional abuse. But what about everyday challenges that cause people to go from living a normal, healthy life, seemingly, to being in a constant state of anxiety and potentially becoming depressed? Normal things. So they don't. A lot of people don't see themselves as being depressed, but they really are, because they don't, because they were not sexually abused or emotionally abused. Or so what about those things?
Thank you for that. And I think I need to step in to say something that we also need to be careful with diagnosing people without the proper process. Why? Because if we keep on saying a lot of people are depressed, a lot of people are anxious, um, that might not help. And this is because until you get a diagnosis, you might not be sure if you are actually depressed or expressing an anxiety disorder. And this is because, in my experience, I have come to see that some mood conditions are normal. Take, for example, you talked about situations in the country or situations happening around them. Take, for example, if I were applying for a job and I've been getting rejections, right? It is only normal for me to feel sad about it. That's normal, right? But if I then misinterpret my sadness as a sign that I am depressed, unfortunately, and this is why it's very important to clarify this, is that unfortunately, the human brain doesn't work with reality. The human brain works with perception. That means that the moment I start to say to myself, oh, I'm depressed, something is wrong with me, I'm this, I'm that, my brain is not going to tell me, oh, Chris, why are you doing that now? After all, you does that, you didn't get a job. My brain is not going to do that. What my brain does is that my brain says to me, oh, you are depressed, things are not working for you. How do I make sure that you feel these emotions or you consistently feel this until you fix it? And so what my brain is going to do is that my brain is going to start to alter my chemical, what we call neurotransmitters. It starts to alter the chemical secretions in my brain. And if I don't watch it over time, I am then eventually going to become depressed, right? And so it's important that the viewers also understand that feeling sad because something didn't go your way could be normal. Depression, on the other hand, is when you begin to feel this sadness, even if you cannot trace it to any particular thing. So you've not seen anything, but you just notice that you feel this sadness, you feel this intense sadness, or you begin to interpret almost everything you experience from a negative perspective. Now, that's when we might start talking about depression. So feeling sad because something doesn't go your way could be normal. But if you misinterpret it or if you don't address that effectively, that can over time lead to depression.
So much, Chris. Well, we've come to the end, but just very quickly, please, can you give us like
Mhm.
three practical steps we can begin to take to change all of this?
Okay. Oh yes. So I have something that I call the me time. Sorry, the me time, and it's an acronym for managing mood conditions. And number one for me is the M. The M says that you need to be able to check in on your thoughts by meditating on them. So think about what is going on in your mind. Identify the negative thoughts and try to change those negative thoughts. Right? That's meditate on the positive. Change the negatives to positive. Meditate on the positive. Now the E part of it is engage with people. So when you're feeling sad, depressed, anxious, talk to somebody about it. Right? Talk to somebody you can trust, or maybe a professional. And then the time part of it is create time for things that you enjoy. Create time for things that you enjoy, things that make you feel good about yourself. It could be learning a skill, it could be going to a massage, things that make you happy, things that make you help you develop yourself. But the most important thing is that if you find yourself experiencing these conditions or this extreme mood for a long time, please feel free or reach out to somebody who can, a professional who can help you deal with this. But mood disorders, anxiety, depression can be effectively managed.
So much, Chris. Thank you so much for that. We've come to the end, as you know, and this has been short but very impactful. And the next time you're here with us, you'll be here physically so that we can have a part two of this conversation. But thank you for coming in and joining me virtually. Fumi, Helen, and myself will very, very quickly round off the show. So please stay tuned for a few more minutes. Thank you.